play the clip from the press conference, but I wanted to go in with the hospital administrator, Lillian Posadas, because obviously there's a lot going on at the hospital. So she's able to give us a little time this morning. We definitely appreciate that. Lillian, good morning.
Thanks, Tomas.
Thank you, Tomas.
Good morning. Good morning, Chris. Good morning, Bree and Jason. And good morning, Guam.
Good morning, Lillian.
How are you all?
We're just happy to be here. I guess.
That's what we started the show with. Happy to be alive. Like literally. I know you say
yes,
that.
we are. We're blessed.
Yeah, we are.
Happy and grateful.
Yep.
Yeah.
But unfortunately, there's some people who aren't alive and aren't.
Our condolences to all the
know,
families.
I know. That's true. It is sad and it's very sombering for the families who lost their loved ones to COVID.
Right, especially to see that they're getting sick at home and dying at home without seeking medical attention, medical care. That is just, alarming.
Yes.
Doesn't even begin to describe it. And let's just kind of start there, Lillian. Can you give us any additional information, because they did put out the general stats here, but what can you tell us about the deaths that were that happened over the weekend that were reported yesterday?
Right. In the JIC, they reported 5. However, throughout the month of September, we've had a total of 7. The remaining 2 have not yet been reported to JIC, primarily because I guess to give the family, the notice plus confirmation of some of the information. But of the 5 that were listed in the JIC, age range from 29 to as old as 80, 81. They're all male individuals. And, all 5, with the exception of one was fully vaccinated. The others were not vaccinated. And the majority of them have underlying medical conditions pertaining to the heart, some with diabetes, some with cardiovascular, meaning high blood pressure, hypertension, some with renal, kidney disease. And so those were the combination of underlying medical conditions that, probably played a factor in their condition and in their demise.
Lillian, I really hate asking this, but has it gotten to the point where what happened last year, right, with the morgue, where they had to break out, container or chiller? Is that something that's happened already at GMH, or?
Yeah, it is. And between the, with the DOAs that come in, the death on arrival, those are considered coroner's cases. And so, them being coroner's cases, meaning they have to go to the chief medical examiner morgue, and they have limited capacity there. And so, that's why we really try and push for the funeral homes to try and, expedite the funeral arrangements of the human remains of the deceased loved ones can be processed as quickly as possible, and so they can come and pick up the bodies of the deceased loved ones to their funeral homes. And for the most part, they have been cooperating. And so this morning we do have some vacancies, but it's just a process that needs to be expedited and facilitated as quickly as possible. We requested because the reefer that we had, the container that we had, and we transformed it into a morgue, an extension of a morgue. That went down, it wasn't functioning, and so they got removed from our premise. And so now we've requested, we submitted a DLAN ticket to get another container, and that we can then use it as a backup for space in terms of the morgue capacity.
How many bodies can the morgue hold currently?
The chief medical examiner morgue, they have 9 refrigeration or cubicles or whatever they call them. For us in our morgue, we have 12 reefers or 12 cubicles that we can accommodate 12 expired bodies.
Over the weekend, there were the deaths that were reported at Naval Hospital. and
Correct.
I think they were brought over to the CME to conduct more
I can't
evaluation.
confirm that if they were brought over to CME because they also have their own morgue. So I can't confirm that they were brought over. I haven't received the information, and that doesn't mean that did not happen. It's just that I did not get that report or that information. Did you guys get that report?
No, it was just in that JIC report that we had to wait for the CME, I guess, to for more information, because it was very vague with the the deaths and whether or not they had any underlying health conditions, whether they were vaccinated, etc. So I didn't know if I guess it would be an autopsy to determine more information about those deaths.
We verified in the GU web IZ, with the names, our infection control and our emergency room. They do verify whether or not those individuals who come in as, dead on arrival, expired. We verified with the GU web IZ of their vaccination status. And so far, only one was fully vaccinated. The rest were not vaccinated.
What is the turnaround time? You said you put in the DLAN ticket for the container. How long would it take to get here?
Well, it depends if it's available on island. My understanding is there is possibly a 20-foot container that is available on island. And so, again, because it has to be sourced where it's available and the cost, what the cost is. So we'll follow up again with the DLAN with the Guam Homeland Security, where they're at on that one. But that's been on discussion, believe since last week or 2 weeks ago.
Yeah, the governor confirmed the 9 COVID-related deaths during the press conference yesterday. Have there been any other deaths?
There was another one that was brought in yesterday, I believe. Yes, it was another DOA came in yesterday afternoon, late afternoon. We haven't yet gotten the details on that one because I think also pending family notification and confirmation. So there was one yesterday.
Lillian, before the pandemic, would it be common to see this many DOAs in this time frame?
No, again, it's not common to see this many DOAs. It's really just related to this, COVID. There's just a very strong correlation that we're seeing. These DOAs, and they're tested. Their bodies are their human remains are tested upon arrival, and that the COVID test results come back positive. So it's very, very strong correlation with the COVID and the DOAs. We have not seen this many DOAs here in this hospital since I've been here since 2019. This is just very alarming.
Yeah. But for the one that was reported or that was brought in yesterday, do you have age range, male, female?
In the 50s. It was a male individual in the 50s.
Comorbidities?
I don't have that information confirmed, but I can get that. I'll try and get that information in terms of comorbidity, but I don't have it right now, and I don't want to say yes or no because I can't confirm it, and I can't really say that the individual has comorbidity.
Do you have an update on Regenco? I know we got the information yesterday from May regarding the shipment. Unfortunate about the temperature control issues.
Right, and so we're looking into that. How can that be prevented? Because we certainly don't want those kinds of medications to be wasted, and so we're looking into that. But yes, we received a shipment of 24 vials, and we have been administering the Regenco in the emergency room BlueMed tent. In fact, there were several individuals yesterday that were given the infusion treatment.
Yeah, I think Public Health said yesterday there were 30 people, I think, on a waiting list. Did you use up all 24?
You know what? I don't know that information right off the bat. I can follow it up because there are still some individuals that I understand scheduled to come in and be given the infusion. So let me confirm that, how much more we have left.
You're anticipating, I guess, I would assume another shipment to make up for the 100, what is it, 44 that were deemed
Right.
unusable.
Right, exactly. We do need to get more. But we also have the dual monoclonal antibody, which is the bamlanivimab and the etesevimab. That's another option that we can certainly, infuse individuals with. And we've got the protocol already approved. GRMC has already started infusing that dual monoclonal antibody infusion. So we do have another option of infusion treatment.
Any more hospital staph infections to report, Lillian?
Yes, we do. In fact, one employee yesterday from a family, from the household. I think family members had the COVID infection, and so the staff, actually two yesterday. There were two yesterday that I received information. Two staff, and it was from the household.
What's the protocol for, like, let's say, I had an auntie who went to GMH for surgery, but she said that she wasn't tested for COVID upon admission or discharge, and then
no, because usually we do test for COVID for surgery. Now, whether or not your auntie was not tested, that probably depends on the physician.
But
and her condition. So that may have been decided by the physician.
Yeah, because she has COVID now. But anyway, so we were just asking, hey, so did you get tested when she went in? And she didn't. She said she didn't, and then she also said she wasn't tested on discharge. So,
okay.
I'm
now
just
she
checking.
has COVID, you said?
Yeah, so I think she went in Thursday, started exhibiting symptoms on Sunday, was discharged on, I want to say, Friday.
Okay. All righty. Did they say where she could have gotten the COVID? Are they doing contact tracing with her?
I haven't followed up. I'll follow up and check. I'm just asking what is so when you do go into GMH for a procedure, you guys swab people?
That's my understanding, but again, it's also the call of the decision of the surgeon. And also in the emergency room, we started kind of putting a criteria that only upon admission, because we were kind of running low on our Abbott testing kits, but we're testing and sending it to public health for PCR. So we continue to test everyone that comes into the emergency room.
How low are you guys running? Is it alarming?
Well, we were kind of concerned, but now we're testing everybody. We're swabbing everybody and sending the specimen to public health using the PCR analysis.
Okay.
Yeah, even the employees, we're testing them, we're swabbing them, and we're sending their specimens to the public health lab for PCR analysis.
I have to ask this, Lillian, because you said you guys were running low on the Abbott test kits. We're running low on Regenco. Is anybody kind of monitoring your supplies and saying, oh, we need to order this so that you never run low?
Absolutely, but it also depends on the shipment. We ordered our Regenco way in advance, but it was the shipment. And, only unfortunately when we received it, it was not contained within the temperature range that it was supposed to. And so we're looking at that one. But yes, absolutely. People are monitoring and keeping track of how much supply we have. And they, take a proactive approach by ordering. But there are just factors sometimes that, affect our supply.
Are you guys planning on putting up any more BlueMed tents?
Not right now, because we're trying to, as much as possible, we are using the BlueMed 10 as an extension of ER, and at the same time using it for the Regenco infusion. And so we're trying to really work with the community and the team, the surgeon cell, the PAC, and GRMC has already launched their infusion treatment clinic right outside of their hospital using a BlueMed tent also. But as much as possible, if these individuals do not need to come into the hospital and get that treatment as on an outpatient basis, that would really be better, particularly for the two hospitals, GMH and GRMC. We're trying to take care of the ones who are really, really sick, who need to be in the hospital, and those who can get the Regenco on an outpatient basis. That would be, the best use of our limited resources. So for now, we don't. I'm sorry, I got long-winded there. I went around the island with my answer. We're not looking at setting up another BlueMed tent. We're hoping that we don't need to.
What about the request to DOD for medical personnel?
Personnel, yeah. We submitted a request through, again, the DLAN, through Guam Homeland Security. And so, with all that's going on at the national level, a lot of the resources are already kind of deployed, with the Afghanistan situation, with hurricanes, IDEN, and all the other events that are going on at the national level. Plus, they're still surging with COVID admissions in the hospitals. It's kind of limited, but they're going to do their best. The HHS and the FEMA folks, they're going to do their best to try and get us the additional resources that we need, that we could use.
Any updates on the SNF?
No update, but actually we got the green light from FEMA to go ahead and proceed with the with a plan for it to become to transform that into an alternate care site. And the first phase of it is the construction of the B wing, so we can split up that ventilation system, and then we can then use the SNF site for both COVID and non-COVID, for decompressing our facility here and using that SNF as an alternate care site for both the residents who are there who are non-COVID, and if we need to decompress our COVID patients from here, we'll use that one wing.
How long is that, something like that, going to take?
Good question. With our government procurement process, it can take a while, but we'll try and speed it up as quickly as we can. We already have the design from the contractor, and so now we're just going to need to bid out for a contractor to do the construction.
Mm-hmm. When you say construction, are we talking about a brand new wing or just renovations to the existing
Just the
wing?
renovation. It takes some construction work to split up those the ventilation units. So that's why they put it under construction. It's a renovation of the ventilation system.
Mm-hmm. And how many, I guess, beds are we talking in the wing?
Okay, the SNF has 3 wings, A, B, C, and so each wing is structured to accommodate 20 beds, and so hopefully that we can use all 20 rooms in that B wing. However, we need to also factor in that we need to have like a nurse's station and some space for supplies and storage and all that.
Has
so possibly 16 or 18 beds is what we can then accommodate patients in that wing. Sorry, go ahead.
Yeah, no, I was just going to ask if GMH has gotten any ARP money.
Not right now. We haven't yet gotten ARP money.
Like, really? Zero? Nothing in this 7 weeks into this surge and the need for resources?
Well, I understand that they still needed to do some, I guess, logistics of it, but we requested for some funding, particularly because, we had revenue loss last year when we suspended elective surgeries. Our non-COVID patient census was down. So we had some revenue, loss of revenue last year. And so we requested for some supplement from that ARP money. But yeah, I've been assured that it will be forthcoming.
Lillian, I mean, you're talking about revenue, and I know you remember I'd asked you about the accounts receivables for the hospital, and I was just looking at the information you guys provided, and
It got updated.
yeah, so it says here that Aetna owed $10.5 million, and then after allowances, 2.3 million. Take Care 5.9 million. So when we talk about the hospital needing revenues and having lost revenues, where are we with
Absolutely.
the collections on these?
What was the question, Chris?
Where,
I'm sorry.
Where are we on the collections with the? I mean, is it a problem getting the money that Aetna and Take Care owe the hospital?
Well, and again, it's because of all the documents that we have to submit, and we have been submitting the documents. We have more billers and more coders, and they are now have received more training with regards to making sure that those claims, those bills are clean and accurate. And so, we've submitted our claims to Aetna, but I guess their reimbursement process takes a while. But they need to pay us that 10.5 million that they owe us, and hopefully that they do pay us that. Take Care, we've been working very closely with Take Care. We've had to do some reconciliation of past bills, and so but Take Care has been making the payments. But it will be great if they can pay us what they owe us. It will really just be fantastic, so we don't we can pay the vendors that we owe.
Right. So Aetna, I mean, they're out. They left Island, right?
I don't know if they left the island already, but yes, they're no longer going to be providing plans for government of Guam employees. So whether they've left the island, I have no idea confirming that, but I guess they're not going to be doing business with government of Guam anymore.
But you are in contact with them, right? It's not like they split and they're not returning your emails or anything?
Right. We've been sending the claims, absolutely. There is that communication still ongoing between our billing business office and Aetna and other payers, health insurance plans.
Thank you, Lillian.
No, I was just going to say that even if Aetna was off island, who is on island is, the governor. And it's just kind of, I can't believe not one single cent has gone to GMH from ARP money.
It's coming. I've been assured that it is going to be coming. So, I'm confident we will get some funding.
What are you going to use it for when you do?
Well, we have payables. We have some vendors that we owe, and so we want to make sure we pay them.
Yeah, that'd be nice.
Yeah.
It's paying bills is what we do. Paying bills and making sure we make payroll and making sure we pay our payroll payables, like the taxes and the insurance premium and the retirement. Those are what we have to pay. Those are the payroll payables that we always need to make sure we pay.
All right.
Thank you, Lillian.
Yeah, thanks, Lillian.
Thank you, too. You take care and stay safe. Okay?
You stay safe.
Yeah,
You stay safe over there.
All right. I will.
All right. We got our pulse oximeter. We're okay.
Yeah.
Yes. Gotta get one.
Got
Thank
it.
you. Thank you, Lillian.
All right. Bye-bye.
Bye.
Hey.
Hey guys.
Hey, Jay.
Speaking of pulse oximeter, Mr. Genius DJ Joser over here, he actually found that there is a pulse. Show her, Joe.
Oh, there's
or
an
show
app.
them, Joe.
There's
Joe,
an app.
There's
And
an
you-
app. Of course.